According to the new World Stroke Organization and Lancet Neurology Commission report, stroke deaths are expected to rise by 50% by 2050. The report further reveals that over 90% of stroke deaths will be in low and middle income countries. Now let's discuss this. I'm joined by Sheila Martins, President of the World Stroke Organization, who's speaking to us from Brazil, and Dr. Nerisha Tathiah, Regional Clinical Manager at Life Healthcare, who's speaking to us from Johannesburg. Ladies, a very good evening. I appreciate your time this evening. Sheila, allow me to start off with you. Now, the World Stroke Organization warns of a 50% rise in stroke-related mortality by 2050, with over 90% of these deaths occurring in low and middle income countries. So let's talk about the impact of strokes on those from low and middle income countries. And obviously this rate is 50% rise is incredible.
Yes, well, thank you for inviting me to be here to talk about this very important topic. And really, we are very worried because we know what should be implemented to change this reality. We need detection of risk factors because 9% of strokes can be prevented. But in low and middle income countries, we have a huge gap in prevention and control of mainly of hypertension, that is the main risk factor for stroke, but also diabetes, dyslipidemia, tobacco use, and alcohol abuse, sedentarism, unhealthy diet, obesity. So these risk factors should be identified and treated in primary care. And also we need to prepare the stroke centers for patients when they have a stroke. We can treat and decrease mortality and morbidity. And in low and middle income countries, we don't have the organization to treat those patients. This is the problem. And for this, if you didn't do anything, we will have a huge increase of patients with the stroke and higher mortality, mainly in low and middle income countries.
Now, Sheila, you represent the World Stroke Organization. So just what work can the WSO play in raising awareness and promoting stroke prevention on a global scale?
Well, we have huge campaigns to aware the population about the risk factors and how they can identify their own risk factors and modify them. Also, we are working together with World Health Organization to prepare the primary care units to do this, identify, achieving, treat these patients and achieving goals with HEARTS programs from World Health Organization. Also, we have an implementation task force working in the countries with ministers of health and neurologists and health professionals to organize the stroke centers with the stroke units, a multidisciplinary team to treat this patient when the patient arrives at the hospital and try to put the medication, the intravenous thrombolytic drug that we have more than 20 years that we know that can be used to change the disability of these patients. And for now, several countries in the world don't have the medication in the country. So we are working with the governments to put the medication in the hospitals and also working with them to decrease the cost to be affordable to every patient. And at the end, in more severe strokes, we need to implement the treatment that is we have approved for 7 years now. That is mechanical thrombectomy. That is the next step of implementation.
Now, Dr. Tathiah, I talked about that 50% rise in stroke-related mortality by 2050, and that's pretty scary. But there is some light at the end of the tunnel, and that light suggests that 90% of all strokes are preventable through manageable risk factors. Talk to us about those that management process of those risk factors.
Yes.
Yeah.
And,
sorry.
Yes. And to Prof's point, they are exactly that, manageable, and the lifestyle factors which are preventable. And these are things around smoking and hypertension and diabetes. High blood pressure is manageable. It is a chronic medical condition that is manageable by your nearest medical provider. So is diabetes, taking care of the sugar and with the appropriate medical care. Now, the other lifestyle factors I'd like to touch on, and Prof also touched on it, is things like having an unhealthy diet, rich in processed food, high in fats, sugar, and we all know that, right? And that plays a huge role, and that is something that we can do something about. Also, not exercising enough, not having sufficient daily activity plays a huge role in being a risk factor for stroke, and as well as obesity, not watching one's weight. And you can see that all of these factors actually add up in terms of creating this unhealthy lifestyle. So these are definitely preventable in these package of factors that actually play a role in terms of what we can do as individuals in terms of protecting our health and preventing these factors that can relate to stroke. And Prof touched on all these factors, and I must tell you that in South Africa, we are very fortunate that we actually have these interventions that are available. But what is important, that we have to identify the warning signs early enough. And if I leave you with one message, it's called FAST. It's an acronym, and it's FAST. And this leads to the warning signs of stroke. F, so if you see a patient that is having difficulties around their face, for example, you see a side of their face starting to droop. A, for their arms, if you ask them to hold their arms out and you start to see one side going down or drifting down. S, for speech, you ask them to say a phrase and, their speech is starting to get slurred. And time, if you note the time that these symptoms start, and then you get them to the hospital or you call the emergency services, this is absolutely vital, because these emergency interventions that Prof spoke about, trying to break down the clot with the thrombolytic therapy, etc., these work if you get them to hospital in time. So FAST is the acronym that we should all be aware of and should be using, because it is absolutely life-saving. It can actually reverse the complications of stroke, and it can really change lives. So this is something that we can do in terms of education and awareness, and it's readily available and easy to remember.
Now Sheila, there's a saying that says a stitch in time saves 9, or prevention is better than cure. Now, in that explanation that we've just received from Nerisha, she talks about how to deal with the situation where somebody is suffering a stroke in the moment, right? Now, I'd like to believe that there is a process of averting a person getting to a situation where the stroke or the impact of the stroke is reduced. So let's talk about at what point should these communications be coming in, Sheila. It's one thing to say, you're 40 years old or you're 50 years old, look out for the stroke. So let's talk to young people, because there is a growing number of young people that are being impacted by strokes. I mean, we read or we see young people in their 30s, and I'd imagine maybe even younger. So when should this communication start, and what should that communication be when kids are growing up?
Yeah, well, that is perfect. We really need to start in children, educating children for a better lifestyle. So avoiding unhealthy food since they are children, doing exercise and not only in the front of TV. Don't use alcohol in abuse, because young people can use a lot of alcohol and start again tobacco use. So we modifying our lifestyle can really decrease the impact of stroke in the world, since we have we start to train children in schools, and also we are training children to recognize the stroke signs and to call the ambulance to save their parents, their grandparents of stroke. So the education starts very soon. And it's very important to know that everyone can have a stroke, including children, because it's very important to know the signs. In any age, you need to go fast to the closest stroke center, so a prepared hospital to treat those patients. So it's very important to aware everyone, including young people.
Now, I'd like to address, if you will, Nerisha, the issues around the WSO, and it's called for action by governments to develop and implement national stroke surveillance and prevention strategies. So this is something that South Africa, as a nation, is being called upon to do. Is this in action currently, or are there things that South Africa can do, and what will those things be?
Well, remember, South Africa is currently celebrating National Stroke Week, so it is definitely a call to action in terms of the education and awareness, and we can all do our part in terms of spreading exactly that, in terms of the messaging around this, in terms of the education and awareness, and in terms of really taking home the prevention messaging and making this part of our lives, changing our lifestyle a little bit at a time. It's not an easy thing to do by any means, but we have to start somewhere. And as Prof said, we can start with the children in terms of our messaging, in terms of how we start modifying lifestyle, how we start really being role models in terms of what we do. But we have to start, even a little bit at a time, because prevention is really where we need to, really start with. But also in terms of, active management, in terms of recognizing the symptoms, acting quickly, getting the patient to care as soon as possible, and then quickly to rehabilitation as well, because that's a very important part in terms of managing the stroke complications and ensuring that the patients have a full and fulfilling life as well. So it's all part of the continuum of care for patients.
Ladies, I must thank you so much for making time to speak to us. Sheila Martins, President of the World Stroke Organization, and Dr. Nerisha Tathiah, Regional Clinical Manager at Life Healthcare, speaking to us from Brazil and Johannesburg.